Hi, I'm Dr. Steve Myers, and I'm here with my patient Peggy. She's 3 months out from a bilateral knee stem cell procedure. Before we talk to her, we're going to take a quick look at her x-rays and see what kind of issues she was dealing with.
Okay, so taking a look at her knees, this is a standing x-ray of both of her knees. The right knee is on this side of the screen, and this is her left knee. If we zoom in on her left knee, you can see some pretty decent joint space. This space between the bones here, this dark space, is the cartilage thickness of the joint. She should have the same amount of space on the inside of the knee here, where she has significant loss of space along with big bone spurs above and below the joint. These are significant arthritic changes in the left knee. Very similar changes going on the right knee, with significant loss of joint space on the inside. This dark circular area here, this is actually a cyst in the bone, which is an advanced degenerative change, indicating significant arthritis.
Okay, so thinking back to before your stem cell procedure, what kind of issues were you having with your knees? What kind of difficulties were you having with your knee pain?
Extreme pain, and nothing helped. It was walking up steps, walking down steps, stepping up and off curbs. I couldn't hardly work on my knees anymore, and I've been laying flooring in my house and building fences and putting down brick sidewalks, and living through the pain, determined to get finished, but I didn't want to have my knees replaced, so I was looking for an alternative solution.
What kind of treatments did you try before your stem cell procedure?
That rooster crow treatment.
Stem-Visc injection?
Yes. And I also had the, I think it was cortisone shots in my knees. That didn't last long at all. And the shots were very painful. And I just thought, I just need to find something that will work with my body. And when I read your site, and you told me everything I needed to know before I ever called you, how it was going to be done, what it cost, everything about it, I was very, very impressed. And I called you, made an appointment, came in, and...
So here we are, 3 months down the road from your stem cell procedure. Thinking today compared to before your procedure, are you 10% better, 50% better, 80, 90, 100% better? Put a number on
I
it.
would put like 98% better, because I still have a little bit of twinging with my left knee. It was the worst knee, and I know it's going to take a little while longer, but listen, 98% improvement, I'm all for it. It's wonderful.
So having been through it 3 months down the road, do you feel like you made the right decision with your treatment?
Absolutely.
And would you do it again if you had the choice?
Yes.
Very good. Well, thank you so much for coming in and sharing your experience.
Okay, thank you.